We are joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily, sir.
Thanks so much for having me.
Now, some really concerning developments in terms of these new variants, Dr. Raut. We know of 3 so far in Canada that were first discovered in the UK, South Africa, and Brazil. So how do these variants differ in terms of their spread compared to the original coronavirus?
That's a good question. So we know a lot about the B.1.1.7, which is the UK variant. It's something that emerged in September of last year and really was the first variant to draw huge public attention because it was 70% more transmissible due to a lot of coding and mutation issues. By December 2020, almost 60% of all cases in London were based on this variant and, of course, has come to Canada as well. We know about the South African variant here, which is spreading quite rapidly in many provinces because of a higher viral load, and it also makes it a little bit more infectious compared to other variants. And then finally, most concerning here, we're seeing the P1 lineage, which is the Brazilian variant here. It's triggered even more deadly outbreaks than the first outbreak in March 2020, and it has a lot of features of the UK variant. So the big concern here is about vaccination effectiveness for them.
So some really interesting comparisons there, Dr. Raut. Would you say any of these strains or variants are more deadly or dangerous than the other?
That's the concern here, because if we look at all three of them do have things that make them more dangerous and deadly now. The changes in the mutations for the B.1.1.7 has increased the transmissibility and also disease severity. The B.1.3.1 and the P1 both seem to cause more deadly disease compared to the original coronavirus as well.
And why are cases of the UK variant popping up in even the most remote communities? And there are also cases of new variants that have no travel history as well. So what does all of this mean, Dr. Raut?
Yeah, so when we see that in remote communities, we know that they still rely on outside supplies, groceries, food, and essential services that still need to be maintained. So even without travel history, we can see that these variants can be spread through these manners there. More significantly, what it tells us is that if the remote communities are starting to see these strains, it means it's likely much more prevalent in the non-remote communities than we think.
And meanwhile, we have provincial officials slowly easing their lockdown restrictions. How will this impact the spread of these new variants, Doctor?
So we saw the second wave peaking mostly because of December gatherings, and lockdowns tended to shut that down quite a bit, including gatherings there. So we do expect that as these restrictions ease, we will see a bit more of a spread here. The important thing here is for people to be very careful and cautious and make sure the gatherings are reduced as much as possible.
And Canada's second stage of vaccinations is expected to start this spring, but how likely would Canada already be in a third wave of this pandemic by then?
That's a great question. So the thought is that Canada will likely already be in that third wave. We have to assume that these new variants will spread very rapidly, and that third wave is unfortunately only a matter of time.
I want to go back to some new vaccine guidance from Canada's National Advisory Committee on Immunization. They're saying that officials should look into vaccinating other groups instead of just focusing on healthcare workers with lower risk jobs. So what does that mean, Dr. Raut? What would that look like?
So it's a great thought here. So many populations are exposed because of increased risk of exposure to the actual coronavirus itself, but many populations have an increased risk of severe disease or death. And the idea is to look at those populations and prioritize them. Racialized populations, low-income groups, advanced age, and those with pre-existing medical conditions should really be part of the initial treatments for vaccinations to help prevent that severe disease.
All right, Dr. Raut, about 30 seconds left, but what else needs to be done to prevent the third wave of the pandemic from hitting us?
I think overall we should look at good infrastructure for schools and facilities to reopen. The most important things we learned from previous were rapid testing, contact tracing, limited gatherings, and vaccinating as many people as possible.
All right, Dr. Raut, again, always great having you on Forum Daily, sir. Thank you.